Welcome to The Other Side, Mississippi Today's political podcast. The Other Side lets you hear directly from the most connected players and observers across the spectrum of politics in Mississippi. From breaking news to political strategy to interviews with candidates and elected officials, we'll bring you facts, perspectives, and context that helps you cut through the noise and understand all sides of the story. I'm your host, Adam Ganucheau. Joining me today in the studio is Bobby Harrison. Hey, Bobby.
Hey, Adam, it's kind of lonely here, just you and me.
I know. I can't remember the last time it was just two of us doing this. And honestly, I've been out and about so much.
Yeah.
Y'all have been doing these podcasts more regularly than me lately, and just I appreciate that, and I'm sure the readers appreciate that too. But they're stuck with me today, and we're doing this. It's just us because it's a weird schedule this week because of the holiday weekend. We are recording this I think it's important for anyone listening to know, we're recording this on Wednesday afternoon, March 27th. So, typically we record these on Fridays, so it gives us a little bit more time to kind of get the events of the week under our belt.
So we
kind of know what happened the previous week so that we can kind of go into the following week when this podcast will air with the full scope of what's going on. So we're doing it a little bit earlier this week. So the preface for this whole conversation today, I think, is some things that we talk about may change just a little bit before this actually does air, but I think we can keep this episode general enough in our topic of conversation that it'll still be really worthwhile to listen to. Topic for today, Bobby, is a really important one. I think it's one that people will hopefully appreciate hearing, and it's certainly one that anyone who is following Mississippi politics is probably pretty zoned in on right now. But Medicaid expansion, for the first time since the Affordable Care Act was passed by Congress more than a decade ago, implemented, I guess, after it was passed 15-ish years ago, implemented more than a decade ago. First time in Mississippi that it's been seriously debated at the state capitol. It's important for many reasons. This is a debate that if you have read Mississippi Today's website or listened to this podcast, you know that we have been closely following the sort of debate about this policy for many years, not just this year, but of course, now that it's here, now that there's a real, conversation happening, we are very zoned in on it as a staff and as a newsroom. This policy stands to provide health coverage up to 200,000 Mississippians. Many of those currently don't have health insurance at all because they can't afford it. This could stand to save a lot of hospitals, particularly rural hospitals, that are struggling to make their ends meet. They're having to completely close down certain departments or services that they offer people. They're having to lay off staffs. They're having to, some hospitals, unfortunately, have had to close completely because of these budget problems. And Medicaid expansion would also bring in, according to numerous studies, a lot of money to the state, a lot of federal money that we're currently not getting.
Create jobs.
And create jobs.
Yes.
And we're talking, 11,000 jobs over, just the next few years if Medicaid were to be expanded fully.
Yeah, I'm sorry, we're kind of getting off track, but even according to those studies, actually grow the population.
That's right. That's right. There are some really big things at stake here. This is not just a debate about a political issue that comes up every year. This is something that, I wrote this the other day. I called it the most transformative policy proposal since the 1980s, when public education reform under Governor William Winter was ushered through the legislature. That's up for debate, but we're talking about a huge proposal right now.
Right. Yeah.
That would be very important to many people. So look, all of that is true. All of that, you can't deny it. This is a huge moment for Mississippi's sort of trajectory and its history. It's one that's certainly worthy of our attention and focus, but it's also one, Bobby, that is a little bit confusing. It's a wonky policy. It's all healthcare policy to a certain degree, unless you've studied it or have worked in it. It gets sort of overbearing at times because you don't really. It's hard to follow it, hard to understand it. And then, of course, when you have a legislative debate about a wonky policy like that, that adds another layer of just sort of confusion and misunderstanding about what's really going on. So I was thinking that for today's episode, since it's just me and you, we can provide a as best as we can, a kind of clear update on where this legislative process is right now, where it stands right now, and what it would mean if the various proposals would pass. So that said, I'm gonna turn it over to you in just a second. But that said, we've got House Republican-led effort, their own Medicaid expansion plan that they passed on February 29th, I believe, the last day of February.
Yeah, about 90 something votes and 122 chamber House.
Overwhelmingly passed. I think every Democrat voted for it, and 75 or 80% of Republicans in that chamber voted for it as well. They passed that February 29th. They sent it over to the Senate for consideration, where it is stalled out. The Senate has been pretty reluctant, more reluctant than the House, certainly, to fast track any sort of Medicaid expansion proposal. They also, apparently, Senate Republican leaders disagreed a lot with the House bill itself. So there was some just disagreement about what they wanted out of an expansion plan. So the Senate, since February 29th, has been, for the most part, behind closed doors, trying to kind of come up with their own plan. Basically, set the House plan aside and say, we don't like this, so we're going to replace it with our own proposal. And we just left the Capitol today, Bobby. The Senate Republicans, after right at a month of that sort of private negotiation and planning, have passed out of committee their own plan. So we have a House plan that passed a month ago. Now we have a Senate plan that passed at least out of committee. Maybe by the time this podcast airs, it will have passed off the Senate floor too. We'll see. But Senate plan is moving regardless. Bobby, in simple terms, for people who maybe haven't been following this closely or don't understand the nuances and the sort of the granular aspects of the plans, in simple terms, can you tell us the differences in the House plan and the Senate plan?
Yeah, just for a point of background, as you said, the Medicaid expansion, it was a component, maybe the key component of what a lot of people call Obamacare.
Right.
And that was meant as a derisive term, but many people now think it's a badge of honor, but we'll let your politics decide that. But the House passed what most people would consider a true Medicaid expansion bill, as 40 other states have done. And that covers, provides Medicaid with the federal government paying the bulk of the cost for people earning up to 138% of the federal poverty level. Now, for an individual, that's about $20,000 a year.
Yeah, we're talking about like people who are making $20,000 a year, individuals.
A family would be more than that, obviously, but for an individual, about $20,000 a year. Now, the Senate has, after that long delay, as you talked about, has taken the House bill and inserted its own language into it, and that covers only people earning up to 99% or under 100% of the federal poverty level, which is about $15,000 a year. Now, there's several distinctions that can be made between the House and the Senate plan, but a key one is under the Senate plan, the state will not get any extra money to provide coverage for those people. Right now, Medicaid in Mississippi, the federal government pays about 77% of the cost of health care. But for the Medicaid expansion population, the federal government's going to pay at least 90% of the.
They've upped it on purpose to try to incentivize states to buy into the program.
Yeah. So a study by Corey Miller at the University Research Center, our state economist, indicated that for Medicaid expansion in Mississippi, because of the incentives you referred to, it would not cost the state anything until about 2032. Whereas the Senate plan, they're going to be covering far fewer people and paying more money to do it.
Yeah. So in essence, the House plan would cover more people, and we would be able to draw down much more, hundreds of millions of dollars more in federal dollars each year to cover those costs, whereas a Senate plan would cover much fewer people, and we wouldn't get that extra incentive from the federal government, that extra money that would come to the state.
After the incentives are gone, which are about $700 million over 2 years, the federal government would still pay 90% of the cost instead of 77% of the cost. Now, you may say, well, that's only 13% difference. But when you're talking about health care, where you're talking about money in the billions of dollars.
It's hundreds of millions.
That's hundreds of millions of dollars
that
the Senate plan would leave on the table.
Yeah.
Now, we're a long way to go in the process, and there's some thought that the Senate leadership doesn't even really believe in its own plan that much, but they're trying to get something to what we call conference, where the House and Senate leaders will try to work out the differences between the two chambers, and maybe what comes out of the conference would be closer to the Senate to the House plan than the Senate plan. We don't know yet. That's that's going to be further down the road in the process, but there's still a long way to go in the process. So I wouldn't view anything as set in stone yet.
Right. That process you mentioned, now if the Senate does pass their version off the Senate floor, it pretty much guarantees that there will be a conference committee debate, like you
That's
said.
right.
That's
yeah.
3 leaders from the House, 3 leaders from the Senate go into meetings together to try to hammer out those differences. Bobby, before we even really sort of talk about the future of the debate and sort of what that conference process might look like, tell me about the votes needed on these bills. So, I guess there's a notion that because it does require because it does deal with some sort of revenue flows, it's going to require a 3/5 vote. Is that right?
That's right. That's my understanding.
So 3/5 vote on the Senate chamber floor and on the House chamber floor to just pass the bill, period.
Yeah.
So that's
And
a higher threshold than the typical majority vote that
Right.
most general bills require.
Yeah, but it's going to take more than that. But there is some people believe the reason the Senate delay has been so long in presenting their plan is the fact that they're trying to, as they work on this, Governor Reeves, who, just a couple weeks ago tweeted he was against this Medicaid expansion because Obamacare sucks. Can I say that?
Yeah.
He's been working.
The governor of Mississippi can tweet it. I guess we can say it.
He's been working behind the scenes to try to ensure that if he vetoes the bill, it would take a 2/3 vote to override his veto, which is a very high margin. So he's been working to try to peel off senators, and at the same time, the Senate leadership's been working to try to get to that 2/3 vote,
Right.
So on whatever they pass. So that's kind of going on behind the scenes in the midst of this complicated healthcare issue, in the midst of this very complicated legislative maze.
Right.
So there's a lot of moving parts.
Put extremely simply, Bobby, Tate Reeves, the governor of Mississippi, is trying to stop expansion from happening.
That's right.
By lobbying senators against passing it.
So so theoretically they could pass it by a 3/5 vote right now, and then it goes to the governor, and the governor vetoes it.
The governor has promised to veto it.
Right, and then it's going to come back first to the House because it was originally a House bill, where based on the vote in February
February 29th.
The House would have the votes to override that veto.
They had a 2/3 vote.
They had well over a 2/3. But then all eyes are going to be on the Senate. Will the Senate have that 2/3 vote? That's going to be could be a real political showdown. The likes that we don't see very often in the Mississippi legislature. So you have this very important, as you said, this very important policy issue that would kind of play out against sort of just the politics and the drama of what could happen in the Senate at that point in time. And it's also interesting in the sense that Governor Reeves, before he became governor, he served 2 terms as lieutenant governor, presiding over the Senate. So there's a school of thought that he still has probably more influence in the Senate than he has in the House. So, and that's where he's kind of what's the battle term? Kind of his last stand is in the Senate to kind of ensure that he gets his way and Medicaid is not expanded in Mississippi as it has been in 40 other states. And so,
yeah. So just a couple more questions about the basics of it. Who's against this at this point? I mean, we mentioned Governor Reeves. We mentioned some Republicans in the legislature are certainly against it. I think there will probably, as we've mentioned, be a harder time for Senate leadership to get yes votes on an expansion plan than in the House. But outside of that, who's against expansion right now?
There's a couple of things going on. For a long time, people argue that the state could not afford Medicaid expansion. But based on what's happened in recent months, including what's happened in the Senate, where the Senate is spending more money on a smaller Medicaid expansion, that's obviously not the issue. The issue is that some people view this as just welfare, and they don't think that people should get free health insurance. Which we can debate that for for a couple of days. I think there's a lot of reasons to make sure people have health insurance. One reason is just kind of the moral right thing to do, but another reason, if the state's healthier, it helps the state economically. But that, those I think are the issues now. People don't want, view it as an expansion of welfare, which, I think that's probably, I may be stating my opinion, but I don't think it's that, I don't view healthcare as welfare, but that's
right. And again, this is a policy that wouldn't just help the people who need it, but it would help, the economy. It would help hospitals.
Yeah.
It would help the small towns that rely on those hospitals and their economy to survive. We're talking about something that's bigger than just welfare. And I'll also point out, a lot of proponents of expansion, this is certainly something that we have written a lot about ourselves too, have argued very validly that Mississippians are already paying for welfare. I mean, I'm sorry, not welfare, but for Medicaid expansion for 40 other states.
Right,
So the poor working people in 40 other states that have bought into this federal program are benefiting from your Mississippi taxpayer dollars or federal tax dollars that Mississippians are sending to the federal government every year, but we're not providing that help for our neighbors. And when our neighbors get that help, it's going to help all of us. I mean, it's just the logic kind of does break down pretty quickly to me.
Look, the Mississippi Manufacturers Association, I've been doing this for a long time, and they're probably as conservative a group as there is association in the state. They lobby at the Capitol for various conservative issues or, for business issues. They have come out for Medicaid expansion. So, I think that says a lot right there.
Yeah. I was going to also ask you just who's for it. I mean, there are various groups. I mean, there's dozens of groups that have come out publicly in support of this over the years, but certainly even this year, manufacturers being one, other business leaders, hospital leaders, education leaders, religious leaders. That's been a big one lately. We've had sort of these rallies at the Capitol of religious leaders, multi-faith. This is not just, one denomination or one group of people. You've got, different denominations and different sort of religions, period, all kind of rallying together, coming to the Capitol and saying, do the right thing. It's definitely a moment. I mean, it's been kind of interesting to see that coalition of people coming together. Bobby, I'll also mention, just earlier this week, I was in Washington for
the eyes of the nation are watching.
I mean, I was in Washington for an awards ceremony. Mississippi Today, we proudly won an award for our coverage of Tate Reeves' campaign donors getting state contracts during his first term as governor. If y'all haven't read that investigation from last year, there's a little plug for it. But we were a national finalist for this award, and we were at the dinner in D.C., and the keynote speaker just happened to be North Carolina Governor Roy Cooper. And I was able to kind of pull him aside and say, Governor, you're the most recent state in America to expand Medicaid, and you were sort of the leader of that effort. Can I ask you a couple questions because we're in this fight in Mississippi? He cut me off mid-sentence, and he was like, oh, yeah, I've been watching it closely. He said, man, I just saw a tweet from Governor Tate Reeves. That was really sad, wasn't it? And, so just asking rhetorically, I mean, it's just, he's watching it. You wouldn't believe the people we're hearing from right now in other states. Arkansas and Louisiana, of course, our neighbors. They're watching it pretty closely. Other red states that have been through this. Indiana is something I heard from somebody, a state leader there this week. We might be putting something on our site up, a little interview from a state leader there.
And he was a Republican leader.
Yeah,
right?
That's right. These red states that have gone through this before, people are watching. There's national headlines. There's national journalists in town writing about the chances of this. So this is a moment that, of course, as we've said and as have discussed many times, this is just a very important debate for Mississippi. Well, thank you for helping break that down, Bobby. I think that it's helpful to kind of contextualize the process, because the process is admittedly complicated and it's hard to follow. But we'll keep writing. We'll keep covering it. There's a couple other big issues I just want to ask you about really quick since I've got you here, and I haven't done one of these in a while. Two other big issues this session that we forecasted early on, just as sort of some of the bigger issues. The state's retirement system, PERS, as it's called, the Public employee
retirement system.
PERS. There you go. What's going on with that? There's some major financial concerns, both short and long term, that the PERS system has. What's the latest on that?
Well, we could spend a day and a half talking about the financial issues, and some people argue there's no financial issues, but the board seems to want to err on the side of caution to protect the system, so they've taken some steps to increase the amount of money going into PERS, and that's made some legislators mad. And the big thing that happened over the past couple of weeks is the House passed a bill. It was kind of a surprise. It wasn't on anyone's radar. But right now the PERS board is made up primarily of people who are in the system, retirees.
They're elected by
people in the
PERS
system,
members,
and PERS would take those elected positions out. It would dissolve the House bill would dissolve that board and replace it with a board dominated by political appointees of the governor and lieutenant governor, and that created quite a stir. I've heard more people on the street just stop me to ask me about that particular bill than any other bill, frankly. And so that's before the Senate right now. The general impression is the Senate's not going to go nearly that far. They may try to add to some more people to the board, but not replace those elected people elected by the membership of PERS. And remember, PERS. There are about 360,000 people, which is over 1/10 of the state, who are either in the system as government public employees at local or the state level, or former local or state employees. I mean, there's a lot of people that this system touches. So it's a big. I mean, it kind of gets complicated, but it's a big deal.
Yeah.
And of course, I think the other thing you're going to ask me about is the school funding.
Yeah,
formula.
School funding. What's going on with
that? Right now, it's the House, the Senate the House wants to do away with the long-standing Mississippi Adequate Education Program, which provides a objective funding formula to fund Mississippi schools, and replace it with another system. I mean, there's some laudable parts of the House plan, but a lot of people are concerned that there's no longer that objective funding formula. And if anything happens at this point, it's going to be in that conference committee process that we talked about earlier. I don't think the House is going to agree to the Senate plan, and the Senate's not going to agree to the House plan.
Yeah. Uphill battle for any major changes, it seems like right now in
I think
public
that's
education
right.
funding.
Yeah, I think that's right.
Well, we'll keep watching those things too. Mississippi Today's politics team at the Capitol every day, led by you and Jeff Pender, Taylor Vance, myself. We've got other reporters in the building every day, just not on just the politics team, but we're trying to keep our eyes on all of these major things.
We've had a lot of people at the Capitol doing a lot of good work.
Yeah, that's right. That's right. We're proud to do it. Really, I mean, we love the public service aspect of this, and anybody listening who has questions for us about these complicated things, or suggestions, or criticisms, or if you want to ask me for Bobby Harrison's address so you can go egg his house, we'll try to hook you up with that too. Just
stand in line.
Reach out anytime. We're always open and transparent with our readers. And Bobby, thank you for being here, taking the time, and thanks for all your coverage and keeping us all informed.
Yeah, thanks for what you do, Adam.
As we cover the biggest political stories in the state, you don't want to miss an episode of The Other Side. We'll bring you more reporting from every corner of the state, sharing the voices of Mississippians and how they are impacted by the news. So what do we need from you, the listener? We need your feedback and support. If you listen to the podcast on a player like iTunes or Stitcher, please subscribe to the show and leave us a review. We also have an email in which you can share your feedback. That address is podcast@MississippiToday.org. Y'all can also reach out to me or any of my colleagues through social media or email. And as always, thank you for your feedback and support. Subscribe to our weekly podcast on your favorite podcast app, or stream episodes online at MississippiToday.org/theotherside. For the Mississippi Today team, I'm Adam Ganucheau. The Other Side is produced by Mississippi Today and engineered by Blue Sky Studios. We hope you'll join us for our next episode.